Thank you, Dr. Harbanslal, for having me invited to this course, beautiful course, because you have been a master in the Phaco. You have written so many good books, and I'll share my experience with the manual Rhexis in hypermature morgage and cataract. See, the Rhexis extension is very common in such cases, and because of so many reasons, the capsule is very thin or maybe hard, or there is very important factor is the high intralentucular pressure. Now you can see, suppose you don't take care of this, what happens? You see that, see it splits, and you have a problem, right? And suppose you are still little careless, a very hypermature cataract, you see that I have tried to use with the Phaco probe, and you can see this is extended. So you have to be very careful. And to make good Rhexis, debulking to reduce the high intraocular pressure is a key factor. You must debulk, and that too with the fully formed anterior chamber with good quality visco. And if you are not comfortable, try to make small Rhexis and then center and then enlarge. See here, I'm trying to show the Rhexis made with the needle. See that the after this it is stained, and then gradually this can be done. It's a good advantage is you can do the from the side port. You can see the main incision here, but still you can do it from the side port. While for the Rhexis and for the forceps, it is better you go from the main wound. Then again you can see that the Rhexis is being made by the forceps, but here you just carefully watch. Here is got little out of way, but so far so it remains. See, then you have to inject the visco, form the chamber, and again you continue. But make sure that the Rhexis margin remains regular. It should not torn or should not extend. See, this is extended, but then it's a regular Rhexis, so there is no problem. We go back, we move further. Now you can see that here the Rhexis, this very old video. Earlier we did not have good gadgets. At that time the fluid would escape, the milky fluid is all fluid cortex. So we must allow the fluid cortex to escape out of the chamber, go on forming the visco chamber, and then do the Rhexis. Now debulking. This is very important. You can see that now I am trying to debulk with the Stellaris Phaco probe, vacuum being 500. I am very careful this time. Only central part, just debulk, and then once it is done, form the chamber, and you can see that you can very beautifully make the Rhexis. However, you have to be careful. That carefulness, proper attention is a must. Is a must. Then of late we have developed this technique. You can see here we have introduced 20 scotch half an inch sharp needle through the side port under the capsule, and you can see that the cortex, the fluid of the cortex is being aspirated, so the pressure is reduced now. Form the chamber. It is edited, of course. Form the chamber, and then you can make the Rhexis. You can see that it is very round, good,
Hello.
and there is less chances of getting extended. So this is of very small gadget, 26 gauge needle, very cheap, very less expensive, and you can still go ahead with that. The important point is, right, then here is another case. I tried to aspirate the cortex, but it didn't. Only the fluid escaped. But still, it was in the anterior chamber, and the controlled fashion. You have to aspirate it and see there is the dye has come out into the anterior. It was debulked nicely. The pressure was reduced interlenticular. Again, form the chamber with the good viscoelastic, and then you can continue with the Rhexis. However, you make sure that your pressure, the force should be centripetal and it should not extend, because you have to keep in mind that the capsules sometimes they cheat you. So the take-home message is the Rhexis extension is very common in hyperimmature morgaging cataract due to high intralenticular pressure, and to prevent it, debulking to reduce high lenticular pressure is key point. And that too, once you must keep the anterior chamber fully formed with good quality visco. However, in some cases, if you can, you have to make initial small Rhexis and then you enlarge it. Thank you very much, everybody.